Factors which have contributed to his respiratory symptoms of frequent coughs and dyspnea include his history of smoking, overweightness, and left-sided heart failure. Smoking causes swelling, narrowing, and buildup of excess mucus in the lungs' airways. This contributes to breathlessness and reduced lung function and causes alveolar damage. Being overweight is associated with dyspnea as it increases the breathing effort due to reduced compliance and respiratory muscle strength in both chest walls. Patrick's left-sided heart failure means that it could lead to possible fluid congestion from the blood backing up and pooling in the lungs, as the heart is unable to keep up with the increased demand for blood throughout the body. The combination of his BMI of 29.3, indicating overweightness, and waist circumference of 104 centimeters contributes to his tachycardic heart rate of 155 beats per minute. His high blood pressure of 135/85 indicates hypertension. Put together with his high LDL and triglyceride levels and low HDL levels demonstrates dyslipidemia and may contribute to atherosclerosis. This is a condition where fatty deposits are on the artery walls and restrict blood flow in the arteries. Consequently, the blood pressure rises to pass the same amount of blood through the narrow space in the arteries, and therefore the heart rate rises in order to pump enough blood throughout the body. Having dyspnea, which is difficulty breathing, will lead to increased heart rate as he will try to force more oxygen into his lungs. In addition, having history of myocardial infarction and suffering from left-sided heart failure and COPD can lead to fatigue and anxiety of falls due to his swollen knee, causing Patrick to likely be stressed. In saying this, short-term stress and anxiety can both increase his blood pressure and heart rate.
Chronic obstructive pulmonary disease, or COPD, consists of both emphysema and chronic bronchitis caused by Patrick's long history of smoking. Smoking, whether current or previous, active or passive, damages the air sacs, alveoli, the airways, and the linings of the lungs. Damaged alveoli interrupts the transportation of oxygen to the blood and carbon dioxide out of the body. This leads to less oxygen passing into the bloodstream through the capillaries that line the alveoli walls. Consequently, the mismatch of ventilation and perfusion could lead to hypoxemia, which is low levels of oxygen in the blood. Additionally, Patrick's BMI and waist circumference indicate that he is overweight. This has consequently led to him acquiring myocardial infarction to a branch of his left coronary artery. Being male, overweight, and having a waist circumference of 104 centimeters means Patrick is very likely to have developed type 2 diabetes. This is also seen from his blood test showing a glucose level of 8.5 millimoles per litre, which exceeds the reference range of less than 6.1 millimoles per litre. Additionally, being overweight means that he has excess abdominal fat, which leads to insulin resistance, increased insulin secretion, and cortisol production. Increased cortisol levels contributes to dyslipidemia and atherosclerosis. Having diabetes and a myocardial infarction to the left coronary artery could have caused him to acquire a left-sided heart failure. It is likely that Patrick would have acquired the COPD from smoking, independent from the heart failure. Having COPD and smoking would have led to decreased oxygen supply to the heart, leading to myocardial infarction in the left coronary branch, and hence a left-sided heart failure. Normally, the left side of the heart receives oxygen-rich blood from the lungs to pump to the rest of the body. However, having COPD, which has led to damaged alveoli and hypoxemia, would have put pressure on the heart as there is insufficient oxygen for proper heart function. In addition to COPD, Patrick would have acquired left-sided heart failure from having a high blood pressure of 135/85. This is from forcing the normal blood flow through a narrowed artery caused by atherosclerosis. Patrick is now at risk of developing right-sided heart failure because of his previous history of dyslipidemia and left-sided heart failure. The pathophysiology of blood flow includes deoxygenated blood draining into the right atrium to the right ventricle and pushed through the pulmonary artery to be oxygenated in the lungs, known as the pulmonary circulation. The oxygenated blood is then taken through the pulmonary veins into the left atrium, drained into the left ventricle, and lastly, forced out and pumped throughout the body, known as the systemic circulation. This cycle is then repeated. Having already suffered a myocardial infarction has suggested Patrick has atherosclerosis due to the high LDL and triglycerides and low HDL levels. This can then cause blood clots known as thrombus to form and break off into an embolus and go to the right side of the heart, causing a blood clot to get logged in the vessels there, which results in ischemia, heart failure. As the myocardial infarction in the left coronary artery has caused tissue death, this has led to an impairment of the left side of the heart in providing sufficient cardiac output. This has resulted in blood flow to the organs being inadequate as the blood carries oxygen. Therefore, the blood flow will be prioritized to the brain, heart, and lungs. Due to this occurring, the kidneys will detect the drop in normal functioning blood flow, assume it is hypotension, and activate an adaptive mechanism known as the renin-angiotensin-aldosterone system, or RAS. The RAS causes retention of sodium in water, which is seen in his blood test results. Normally, having an increase in blood fluid will result in the blood flow being able to reach the kidneys. However, the issue is the left side of the heart not providing normal cardiac output. Due to the activation of RAS, this has caused the right side of the heart to be given more blood flow to push to the lungs but is being overworked, therefore causing a malfunction or fatigue which causes heart failure. Patrick's blood test results show high sodium and potassium levels and low calcium levels, which are 150 millimoles per litre, 5.2 millimoles per litre, and 2.05 millimoles per litre, respectively. The normal range for sodium is between 135 to 145 millimoles per litre. Having high sodium concentration in the blood, hypernatremia, shows that Patrick may have excess sodium being retained in the kidneys. Hypernatremia can lead to vulnerable fluid loss, loss of thirst mechanism, and alterations to brain functions and natural electrical currents. His test also shows high potassium concentration in the blood, hyperkalemia, as it should be between 3.5 to 5 millimoles per litre. This could be a result of insulin deficiency due to the glucose levels of 8.5 millimoles per litre exceeding 6.1 millimoles per litre, as insulin causes potassium entry into cells. Both are essential for neuron and muscle function and important for restoring and resting membrane potential and initiating action potential. There are also low levels of calcium in the blood, hypocalcemia, which indicates potential renal failure. This can be due to the excess sodium, potassium, and glucose needing to be filtered by the kidneys and overworking them. Calcium deficiency alters the cell signaling processes of synaptic transmission, contraction and expansion of blood vessels, muscle contraction, hormone production, and even brain development. Additionally, all three tests examine the kidney function. Normal kidneys function to remove excess water and waste, that is, sodium and potassium, from the blood. However, the tests show that there are remnants of excess waste in the blood which can become toxic to the brain and cause seizures and strokes. Also, hemoglobin levels of 111 grams per litre were below the reference range of more than 130 grams per litre. Low hemoglobin concentrations or anemia, especially in the elderly, indicated decreased renal functions as well as worsened cognition. Anemia causes low semantic memory and perceptual speed and can have occurred due to kidney failure and nutritional deficiency such as iron. It can also lead to cerebral hypoxia.
An additional blood test which would be abnormal and needs to be checked is the creatinine levels. Creatinine is a chemical waste molecule generated from muscle metabolism. Creatinine is transported through the bloodstream and filtered in the kidneys to be excreted through the urine. As the kidneys maintain the blood creatinine within the normal ranges, if it is unbalanced, this signifies impaired kidney function. The normal levels of creatinine in the blood are approximately 0.6 to 1.2 milligrams per deciliter in adult males, but can decrease slightly for elderly. His kidneys would be showing impairment from overworking them, due to the increase in toxicity in the blood, including glucose, sodium, and potassium, which therefore results in the blood test indicating excess creatine levels.